Newry, it's the morning programme. Good morning, Newry and morning the world out there. Leslie Leeman is with me, Assistant Director Performance up at the hospital, Daisy Hill Hospital. You can see why I'm pleased we have folk from Daisy Hill in to talk to us. And Ronan Carroll, a man of Newry. No, if you're, as they say, breed, seed and generation. I've known. Right. Your dad's fine and your mum's still with you, yes?
Oh, absolutely.
Thanks be to God.
Well.
Give them both my fondest regards.
I will indeed.
And you're the Assistant Director of Cancer and Clinical Services there.
That's correct.
First of all, may I say how thrilled I am to have Daisy Hill at the heart of our community. I know for instance, your new A&E up there. It shimmers. It's wonderful. It's great. And congratulations on that. You're a hospital now. Architecturally, it's in the old style, but you grow inside and good things are happening. I've known many of the things you've done there. I was with you for a hernia sorting out.
And in fact, I remember you being a patient there. I was the ward manager in that ward.
When I was in for the hernia?
Yes.
For goodness sake. Because I had been in Africa and I'd lifted a lump of a big tire from a pickup Toyota truck in the bush, and I'd done it wrongly, and eventually I said I'll go and get the hernia done. But it was great fun. I laughed and it was great crack, and because when you go into hospital, you either go in and hide under the sheets, or you intelligently engage with everything that's going on, and you get the best possible experience, you know. So what's your task up there? What does your title translate into then, Leslie?
My role is performance improvement. So my job is to continually look at how we're doing.
Yeah.
Okay. To look across the things that we do quite well. Mm-hmm. To look at the things that we could improve.
Yeah.
And to look a bit at the things that we need to develop a bit further.
Right.
So it's about looking at a range of indicators that take the temperature of the organisation.
Yes.
Are we doing well? Are we doing as best as we could?
Yes.
And there's various measures, Rowan, that we look at. We look at how we do compared to how we've done in the past, which is always good to know where you're going and where you've been. We look at measures that compare us against targets that the Minister or the Executive set. But one of the very important things that we're doing at a much greater level now is looking at ourselves against other good hospitals, and it's about comparing ourselves to the best.
I know you can't comment on this, but I'm more excited about you comparing yourself and working with other centres of excellence rather than that place which is demonstrably not of excellence that's called Stormont. So you can chastise me for that and I accept it. You can't say anything like that at all. But cancer and clinical services up there. Cancer seems to be the thing that occupies our every waking moment. We are susceptible to the awfulness of cancer, and up here, that's the first stopping point on the journey to recovery or to demise.
Well, that's correct. I mean, within Daisy Hill, we've got a full range and suite of diagnostic ability and facilities to see the patient, first of all, at outpatients, then take them through whatever diagnostic test they require, then bringing them to their surgery if that's required, and then also then post-operatively, once they've had their surgery, if they require chemotherapy, well, we would do that then in Craigavon, in the Mandeville unit. So yes, it is common, but we are very good at it, and our survival rates are very good. And which is fantastic news. I
had the great, and I'm been careful in my use of language here. It hasn't been a disaster. It has almost been a joy to discover I had prostate cancer 3 years ago, and I was proactive myself in finding out about it. My PSA blood levels were up, and we monitored them for a time. They're now down from 12 where they were down to 5, and there's a constancy there. But I found that the event of getting this cancer allowed me to speak to other men of my age and say, look, guys, once you're over the 50 mark, start keeping an eye on your bloods and see where you're going. But it's been a journey of learning, and also a journey of great confidence in what I've been getting through the medical service, you know. And I think men out there have that age should be keeping an eye on things.
Yes, we do need to encourage men to look after themselves better. We're not particularly good at that, but we'll get there.
I think so. I'm a coward, you see. That's why I look after myself.
Well, I think men's exposure...
Because I don't want to die yet,
Yeah.
you know.
I think in your lifetime, I think one of the reasons is that men's exposure to the healthcare is a lot less than females.
Yes, yes, of course.
And so they're a bit apprehensive about it, and they just leave well alone.
Oh, yeah. And the trouble is, it's not well.
No.
And this, I often say that this prostate thing, it's a sneaking kind of job that hides in there halfway between your belly and your bum, and it'll take you out if you're not careful about it. And people should be careful about it. When did you get involved? What's your provenance in health then?
Well, I've worked in the hospital system and the healthcare system for about 25 years.
Yeah, where are you from?
Well, I'll not make any apologies for being from Armagh.
Yes, you know, you
I'm an Armagh girl.
You can get tablets for it.
I started working in the hospital system in Banbridge Hospital a few years ago.
Yeah.
A few years ago. And I've worked through other
on
acute hospitals.
On the administrative side?
Yes, I was a secretary to a lot of our consultant colleagues who
Yes.
visited from Daisy Hill down to Banbridge to do services and clinics and to some of the others. So that's where I started, doing the reception, working with the consultants and working through the administrative process.
Have you seen big changes in the time from the start to now, and what are those changes?
Certainly there's massive changes, but we're much more aware of what we're looking for in a system now. I think we processed people and we done it well with care and kindness, but we're now much more interested in the clinical outcomes.
Yeah.
Has our treatment been effective?
Yes.
Is it safe and of high quality? And what did the patient think? You talked about your own journey there.
Absolutely.
Through the healthcare system, through urology, and we're much more tuned in to getting that feedback of the patient's experience now and ask people what was good, what could have been a little bit better, because that all comes down to helping us improve ourselves, because it's about continuous improvement.
Absolutely.
And I think we're more tuned into that now, and we're more receptive to look at those things, feedback in any way it comes in. Should it be a compliment or a complaint? Or a lot of patients participate in audits and surveys and tell us what to think, but we take it now, and I think we're better at listening.
Is there something called a patient? It's a patient. They send me things out. It's a counsel, a patient consultative counsel or something.
Patient-client counsel?
Yeah, something like that. And I don't know, I just signed something and they've been coming back. Your journey, Ronan.
Well, I'm a nurse by background.
Are you?
Yes, I am. I trained.
You're a sacred man.
Well, there are a few of us, but yes, we are sacred.
I think so, I really do.
I trained in Belfast, and I was in Belfast for the first 6 years of my career, but for the last 24 I've been attached to Daisy Hill, and I've worked in probably every ward in Daisy Hill.
Yes.
And so I'm in this current job for the last 7 years, which spans both Craigavon, Daisy Hill, South Tyrone.
Yeah. And what is the job? What is your job?
Well, I'm responsible for delivering the services which I have responsibility for. So the cancer services, the radiology services across the entire Southern Trust.
Wow, it's a big area.
All the theatres, which we've got 18 theatres across 3 sites, the intensive care unit, allied health professionals, OTs, physiotherapists, and our laboratories both in Daisy Hill site and in Craigavon. That's my range of responsibility.
It's a big responsibility, isn't it? You're measuring performance. You're measuring at a different stage. You're actually making sure that the thing is delivered in the way it has to be.
Well, we're delivering clinical services to patients and outpatients and to GPs. For example, in laboratories, we deliver a lot of GP services.
I was sending you my blood today, my regular checkup on my blood.
Well, we look forward to receiving it.
Wouldn't you just? It's a very fine blood. But there's the thing, I'm supposed to be, you fast always. But fast doesn't apply. I had water at 5 o'clock this morning, that's okay.
Yes.
I think for going for a blood test. You don't know, do you? Do you know?
Well, it depends. It depends. Is it lipid?
PSA.
A PSA, okay.
Yeah, that's it.
We fast for many tests. Lipids
yeah.
is probably the most usual one people fast for.
But I can't help reminding people, every opportunity I get, at a certain age, men, go check it out and make sure you're on. Because my consultant at the time told me that 80% of men of 70 my age, 80% have prostate cancer. 80%.
Yes.
It's a big percentage.
It's a high percentage.
We don't seem to have the same problem here as they do at the RVH in Belfast. We don't have crises. We don't have people waiting in corridors. Why is that? Why are we so much better there?
Well, I think we work hard as a network of hospitals, and we work hard at processes and systems which allow the patient to be processed, for example, in ED.
ED?
The emergency department.
Ah, yeah.
And they are triaged or seen to by the nursing staff, quickly followed up by the medical staff, seen by senior doctors. Diagnoses are made, and then decisions are made either to admit the patient or to discharge the patient. But also with patients who are admitted to hospital for elective procedures, they are advised and informed very early in their journey that their stay is going to be a lot less than it used to be. So when you had your hernia, you probably stayed.
Oh, just I went out. I didn't stay overnight.
Oh, right, okay.
I don't think I did.
Okay.
Oh, no, maybe I did. But I was away by 12 o'clock or something the next day, you know. And I wakened up, and that great Newry man, I was coming out of anaesthesia and opened my eyes, and there was Joe Ralph, the Dominican, big Joe with a beard and a big hairy head. And he's looking, and he said, "Ronan, are you all right?" And at that moment, I knew the value of someone making contact and offering a kind of a kindly word.
Yes.
That was Joe Ralph.
Yes.
And
so we work hard at admitting patients and also then discharging the patients. And the relationship between Craigavon and Daisy Hill has got very strong in terms of sharing the resources. And if one hospital's in trouble, then the other one, takes up the load.
Absolutely.
And I think it's very important not just to look at the front door, because ED, emergency departments, where people present, and we have about 120,000 presentations every year across our system. We have 500,000 contacts generally in our hospital system, but it's about the whole hospital working together. It's not about separating the pieces along the journey. We want that flow right from ED into the wards, as Ronan's describing, through the diagnostics, and out the other end, supported and into the community for the care that you need. And I think it's about joining that up, but can't underestimate the work that does go into trying to keep that system joined. Because
but it's that network of availability to you.
That's correct.
And if you're using that and managing that well, it's working.
And people knowing their jobs and being good at their jobs is very important, which our staff are.
Yeah. I wonder, I just don't know, it's you're constantly under pressure because it doesn't go away, and there's the working hours of doctors and all the rest of it. How are we in our area with working hours for doctors? Are they doing huge shifts and stuff?
No, the technical term is that they're European Working Time Directive compliant.
Wow.
So, which is a big word, which means that they're, in terms of the legislation, they're working their hours that they're meant to be working.
Yes. Yeah.
So the old tradition of working 100 hours every week, they're gone.
Yeah.
So that's good. And we've got a full complement of consultant staff in both hospitals, which is very good in terms of leadership and stability and sustainability for both hospitals.
I remember your consultant, Mick McCann. I remember the time triage was introduced. And triage is the business of prioritising the nature of the ailment on the person. The blood's running out of you. Do I staunch the blood before I get you breathing again? All that sort of stuff. And so that, you were trailblazers then. That's about 20 years ago that came in, the triage thing,
Yes.
But managing the hospital system is extremely difficult. It's a complex system, and it is about the two hospitals working as part of a network, as Ronan has said, because we're managing risk every day in our system.
Of course you are.
And then we're trying to manage that standard of care that is of a really high quality.
Yeah.
And then we're managing demand. And the demand seems to be coming in thick and fast. So it's about managing that, as you said, making the right calls, and all of that within the resources that we have, and trying to make sure we're evidencing some sort of value for money for the public purse.
I wonder if we the public, if we need a bit of education in terms of the times we run to A&E. Are there too many of us going with too little wrong with us? That needs to be rethought, perhaps. And then you hear the crying, "Oh, I was there for 3 hours, blah, 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 blah." Yeah, the question really is, are there people coming to you now who really don't need to be coming to you at A&E.
And there's a whole process, as you say, about educating and self-care, because self-care can start with you. It can start with you reaching out to the health professionals around you in the community. Your pharmacist is a very good source to people, your local health professions that may work in your primary care centre, your GP, and there's an escalation process around going through, like if it is a true emergency. Emergency department is the place to come.
Absolutely.
But if it is something that has been brewing for a day or two, we would hope that people would take the steps through the system that mean the folks in greatest need get seen without the big waits. But people do come, and we have to try and direct them accordingly and manage them, as you say, through the triaging system.
Yeah. What are the specialisms you have up there now?
We've got a full range of modern day healthcare services. So we've got an emergency department recently refurbished.
I was complimenting you on that,
We've got a full range of imaging, so we've got a CT scanner. We've got capacity to do ultrasound, plain film x-rays.
Yes.
We've got we've got 5 theatres in total, but 2 of those are brand new. Wow. So 4.6 million investment. Wow. So we've got 5 theatres, a new recovery, a new decontamination unit. We have inpatient medical beds, inpatient surgical beds. We've got a high dependency unit, and we've got a full range of integrated women's and maternal health, so an obstetric unit and a paediatric. So a full range of services are available.
It's makes you very proud
and
in Newry. And outpatients as well.
And the services are of a high standard. Both Craigavon Hospital and Daisy Hill Hospital are nominated Queen's University Medical Teaching Hospitals.
Wow, yes.
So they're providing the standard of teaching and support to the undergraduate medical students, and that's a significant part of what we have to do in a hospital system. And there have been a lot of visits up to Daisy Hill from prestigious folk in the British and Irish medical councils looking at the way we even embrace technology. And I think Siobhan Hannah was with you a few weeks ago talking about the wonderful robots we have at the bedside and the technology that we have.
So that robot, you could be conferencing with a specialist in Canada, London, wherever, and it's all it just opens the portal for more intelligence to flow into the treatment process.
And in our children's services, we have one of the high-tech, I think it's called a high fidelity, sounds very technical, simulator, which is a system that allows staff who have trained and qualified to keep up their training. It's like mannequins, which are representing, simulating infants' conditions and older children, to allow people to work through and to train. And there's been a lot of interest in that. That is one of the most up-to-date pieces of kit in that area.
You see, I love surgery. I really, really love surgery, and some of the best television I've made with Nationwide. I was with Michael Kieran's, the lead breast surgeon in the Mater in Dublin. And it was beautiful television, because it's just amazing what you guys do. He retained the dome of breast skin and removed through keyhole procedure the mincemeat of the tissue inside. Did an immediate biopsy on the area at the nipple, discovered that it was okay, retained the nipple, checked out the sentinel nodes and stuff like that to make sure it was all good. All was good. Mobilized the latissimus dorsi muscle and introduced it subcutaneously into the breast cavity, which along with a prosthesis allowed him to rebuild on the same day. And it was 8 hours of a surgeon working. And I said it was beautiful because the imagery, they were using diathermy, and you saw the smoke coming up, and you saw the kind of silhouette through the skin as he was working. Huge things. And then hip replacements. That's gorgeous surgery, where you just a little piece this size here, and you're taking out the bad, and the person sitting there under an epidural and just twiddling his toes almost. Well, not quite, and it's done, and it's carpentry.
Well, Rowan, I'd have to say that my daughter's a first-year student nurse, and she saw her first hip replacement this week.
You talked
and
to
she
her
was
about
blown away. She
Isn't
was
it?
blown
You tell
away.
her.
She said it was fantastic. And
You
as
see,
you
there
say,
you are.
the
It's just-
competency and the skill of the clinicians working together with the wider team and all the support team that make theatres, for example, work as it does, and
Yeah.
the recovery and the journey back to the ward. But it is about everybody doing their own piece
Absolutely.
really well.
But they're really medical gunslingers, the guys who and girls who go into surgery, because I remember Jeff Blake saying to me, look, the most beautiful sound in the world for me is the sound of the wheels turning in the trolley coming into me. Bing, and he gets. And then when I was getting my hernia done, I was on the trolley with the pre-med, and I was aware he was literally pacing up and down, ready to get going. There's an energy there that flows from your surgeons,
They're very enthusiastic, and I suppose, as Leslie said,
team.
they're highly trained and highly skilled, and they obviously do their best work in operating theatres.
Absolutely.
And it is about looking at the outcomes more now, because the skill is there, but it's making sure everything is safe and effective and you are getting the right outcome. And part of looking at our performance is reading across that to see if our outcomes are as good as other hospitals and indeed better. And recently we have used that looking across, Rowan, to other hospitals through...
Where might you look?
Well, we're looking throughout the whole UK. We use a company that takes our data anonymously, and they compare our data and outputs with those of hospitals throughout the UK, and they tell us how we're doing, because we want to continue to be
How are you doing?
in that. Well, this year we received the top hospital award.
That's right. Of course you did. We got so interested in everything else. Tell the people about the great award. Top hospital award, I tell you.
Each year, this company that we work with, and hospitals voluntarily submit their data, assesses a range of indicators, clinical indicators and outcomes, and efficiency things as well, to see how we're doing, and they compare us, and they come up and they award the top 40 hospitals. So this year, our hospital network, Daisy Hill and Craigavon, was awarded the top 40. So there are 40 hospitals that are picked from out the UK who get that award.
And you're in there.
And it's fantastic, because the staff are dedicated day and daily to providing the best standard of care to every patient every day.
But it's
It's a lovely validation of what we're doing. But I think more importantly, Ronan, as my mum says, you can get an A, but we've held that for 3 years. This is our 3rd year that we've kept that place in the top 40. So it is a good validation, and it's about, we think we're evidencing what we do well. And although that looks at, as I say, the clinical and the effectiveness things, we're also as interested in those patient experience things that really tell us what else makes a top hospital, because it's not just the hard indicators.
No. Something as beautiful and simple as the artwork you put on the wall of the children's area, as the presence of a room of contemplation for people who want to be quiet for a time, Ronan.
Yes.
That's all good.
And I suppose, as Leslie says, we try to marry the hard data with the soft quality, with things that really matter to patients, about how they're communicated with, how they're spoken to, how much information they get, how they feel in terms of have they participated in their journey. We want patients to be less passive and to be active partners in their journey, because it is their healthcare that we are involved with.
At the time, maybe 10 years ago, maybe a bit more now, I don't know, when my daughter was in a road traffic accident and broke her neck, and we brought her up, and the big Welsh nurse, you will know him, I'm sure. He was a Welshman. I can't remember. He's still there.
He's still there.
He is indeed. And I wrote about the whole experience afterwards, and I wrote about the conversation that he and I had, and the way, with strength, honesty, and compassion, he told me the worst news, but also told me the best news, that it was going to be all right. And you're constantly doing wonderful things. I hope you'll come back again to the programme.
We'd like to, and thanks for inviting us along this
At
morning
any time,
to join your sofa.
we are your, let us be part of your shop window. And we want to be part of, and nowadays you've got rid of all those smoky people. Do you know that in my lifetime, when my wife was having our first child, I stood in the labour ward and almost got a soapbox out and demanded that everyone in the labour ward stopped smoking. In the ward! Can you believe? But you guys have got that now under control.
Yes.
Change times. I
Change
think.
times.
Thank goodness. So the big cancers you're dealing with now, because obviously lung cancer is the biggest in Northern Ireland.
Yes.
And, for men, the prostate thing is serious. You
Yeah.
know, need to watch out and all of that. Don't forget, if you're over 50, keep an eye on your blood levels to make sure you're
And,
okay.
and for the females, breast cancer.
Breast cancer.
And we're installing new digital mammography
Excellent.
unit to serve the entire trust.
Yeah, excellent.
And that'll be based in Drummalane to serve the Newry Mourne population.
Okay. It's been wonderful having you in. A real thrill, because I love the whole business of medicine. But it's interesting, you know, nursing. Your daughter's a nurse. You're a nurse. My grandmother Hand was the Catholic midwife on Mary Street 80 years ago. Ma Graham, who took me into the world, was the Protestant midwife on Mary Street all those years ago. My number 1 daughter is a nurse and a midwife. My number 4 daughter is a nurse practicing at the moment. You know, we're privileged to be able to care for people, aren't we?
Absolutely.
Yeah,
It's
I
an
Without a
honour.
doubt, an honour. It's a responsibility, because we're required to be good to our neighbour, aren't we? That's it. Guys, thank you for coming in. We're going to say farewell to the folk now, so stay with me till we do that. Thank you.